First though, our resident Dr. Frances Pitsilis joins us to look at why we could be suffering at any age with brain fog, forgetfulness or difficulty concentrating, and how this can be treated. Good morning, Dr. Frances.
Oh, good morning, Carly.
So this is relatively normal and can occur at any time. So what sort of situations have you seen patients with memory problems, trouble concentrating or thinking?
Well, I think a lot of people wouldn't think it was normal, but I see it commonly and it can occur at any age. And it's more likely to occur in people who've had a lot of stress or illness, and it's the inflammation behind that affecting their brain. There could be deficiency in nutrients or hormones, also with too much alcohol intake, which affects the brain, and you see it in depressed and anxious people.
So what about brain fog? What is it and what can cause it?
Well, my first thought about brain fog is to think about checking breathing, because it's a typical symptom of disordered breathing, but I do see it in people who don't have disordered breathing, who've had a lot on their plate and are really run down.
What's disordered breathing?
Yes. Now, disordered breathing is where the breathing pattern is more into the chest and not into the abdomen and diaphragm. People don't know they're doing it. It's the first response to fight or flight or a feeling of threat. If you've had a lot of stress or a lot of illness, you'll do this without knowing that you're doing it. And it can mimic a lot of other conditions, which is why people don't find solutions. They end up going to different people for symptoms like brain fog, chest pain, tingling, memory problems, fatigue, panic attacks, headache, migraine, poor thinking and concentration, and bad sleep.
It's so interesting, isn't it, that people can have all of those problems and you go to a holistic practitioner or somebody like yourself and they say, well, how's your breathing? And you think that breathing could be a solution to some of those things. It's amazing. Breathing from your belly has such a profound effect on your well-being.
Exactly. People don't think that something as simple as breathing could create some quite dramatic symptoms.
So what would be your approach to helping with memory, concentration and thinking problems?
Well, I think it's really important. A lot of these people don't sleep well. So I think one of the important things is to help people to sleep well. And you need to do whatever you can. Correcting some imbalances helps sleep, like vitamin D and B12. But give melatonin if you have to, so that maybe you don't need sleeping pills, because good melatonin is anti-inflammatory for your system. Get the lifestyle sorted with the alcohol and adequate exercise, and get the diet full of multicolored veggies, fish for omega-3 fish oil, and maybe making sure that there's enough B12, zinc and iron in the diet. Correct any deficiencies, and as I mentioned, look for hidden causes like breathing, infection or anything else.
What about having a poor memory when it comes to things like names? I'm a shocker for this.
Yes, look, I get this sometimes, and I have patients who start telling me that they're usually over 50, and I say to them, look, you're not alone, but there's not much research on it in relation to what is a direct cause, and I found a lot of research on stroke type stuff, but I was able to find information showing me that your brain starts to lose its omega-3 as you age. And so your cell membranes throughout your body and in your brain require enough lipids, fats, to work properly. And so those channels can be helped by improving something called phospholipids, because they are in your cell membranes. And they help your nerves to work better with excitability adequately and membrane transmission for your neurotransmitters. Now, the other benefits of phospholipids are lowering cholesterol, premenstrual syndrome, hepatitis, liver problems. Now, where do you get these phospholipids from? You get them from soy, egg yolk, cow or pig liver, lean meat, fish and shellfish. Now, as well as that, you could consider putting into your omega-3 stable some krill oil, because krill oil contains phospholipids and something called astaxanthin, which is anti-inflammatory. Now, if you want to go even further with your phospholipids, you can actually buy something called phosphatidylcholine as a supplement. It's very good for memory. And of course, phosphatidyl and choline. Now, choline is a component of acetylcholine, which is a memory neurotransmitter in your brain.
Okay, off to the pharmacy I go after this. Hopefully I can remember what they're called. I'll go for the krill oil for something simple to start with. What about the effects, Dr. Frances, of our hormones on our memory?
Well, look, researchers have found that stress and disease drain not just your nutrients, but your hormones. Now, stress also causes your hippocampus, which is in, well, there's one on each side, your hippocampus in your brain to shrink, and that's not good for memory. And it also reduces brain-derived neurotrophic factor, which is brain food. Now, all of your hormones are made from cholesterol, and that includes vitamin D. And I found that when vitamin D is very low and I help it, people start sleeping better and their cognitive function improves. Now, all of your sex hormones and thyroid have a role in memory across the board.
So when should we be more concerned, Dr. Frances, that something is wrong? You know, we're not just forgetting people's names. What are the signs to look out for?
I think it's important that if you lose, or someone you know loses the ability to think rationally and be able to solve problems along with your problem with short-term memory, then you should worry. It doesn't have to be dementia. I can think of a case where this sort of problem started to come on, and he was an older man, but he ended up having quite a large benign brain tumor. So you don't, it doesn't have to be cancer, and it's really rare, but I think if you're not sure, you're concerned, you must check this out.
Wonderful. Thank you so much, Dr. Frances.
Pleasure, Carly.
And if you are concerned about anything we have discussed today, do contact your own health professional.